right, welcome to Live with Dr. Nancy on Wednesday at lunch. We have a very special topic today I'm really excited about, and I think you're going to find it really informative. So I want to say beforehand, if you would do us a favor and share this, because it's a great topic, it's going to help a lot of people, and it's something everybody needs to know. But before we get started, I just want to remind you about our Have a Heart campaign that we're doing. Tomorrow's Valentine's Day. Happy Valentine's Day, everybody. We are raising money for Oklahaven. It's a children's chiropractic clinic in Oklahoma, and they treat special needs. People come from all over the world to be treated by the doctor there, and it's a not-for-profit. So every year, chiropractors like to get together and raise money for this great organization. And so to sweeten the deal, I'm going to match every dollar that's donated. So if you guys could, help us out, we've just got until, looks like the 18th until this campaign ends. So I'd appreciate helping, and I'd be very happy to donate $1 for dollar, every dollar that you send in. So thank you for everybody who has donated. I appreciate it. And let's get on with the show. So today I'm introducing Bob Wallace, and Bob is a fireman and EMT, right? You said?
Yeah, paramedic, firefighter paramedic, yep.
Yeah, he's going to teach us today about CPR for infants and the Heimlich maneuver. So, Bob, I'm going to let you take it away and tell everybody a little bit about yourself.
Okay, thank you. My name is Bob Wallace. I'm with Indiana Safety and Health, and that's one business I own, and we provide CPR and first aid training to several thousand people a year. We train about 1,500 to 2,000 people a year. We've been doing this for about 2,000. And as far as my background, like Dr. Cooper mentioned, I'm a paramedic firefighter here locally. I'm Advanced Cardiac Life Support or ACLS certified, Pediatric Advanced Life Support certified, of course CPR certified. I'm a regional instructor trainer, primary instructor, which basically means I can teach EMT and paramedics and all that good stuff. So I've been to several thousand classes over. I've been a firefighter for, 22 years now.
Oh, wow.
Since 97 professionally. I've actually been in the fire service since 92, but I've been a career firefighter since 97. So I have a little bit of experience, and I love what I do, and I love teaching people.
We are very excited to hear what you got. Do you want to start with the CPR part? Or?
Yes, I think that'd be good. So when we teach CPR, we teach it in 3 different age categories. We talk about infants, which is 0 to 1, children, which is 1 to puberty, and adults, which is puberty and above. And I'm just going to kind of show that child and infant today. And then the biggest thing is that they've made CPR, that CPR changes about every 5 years. They do studies and they update the CPR standards to, go with whatever the latest scientific advancements are and the scientific data that shows. And so if I show something that you're like, I don't really remember that, it may be because you've had an older class or you took that certification, back at the older standard. Now, if you did take that certification at the older standard, that's okay. Do what you were taught. The most important thing is that people do something. And that's the reason there's been a rise of compression-only CPR. Traditional CPR is when you still ventilate the patient. But if you're ever afraid of ventilating the patient because of, say you don't know the person or there's some fluid around them, it's okay to do compression only CPR. But what I'm going to demonstrate is traditional CPR, which is what we traditionally teach. And I'll start with child. I feel like I'm talking fast, so at any point, interrupt me if you need to.
I'm going to make you the focus here so people can see.
So on CPR, like I said, it's between the ages of 1 and puberty. And the first thing you always want to do is you want to check for responsiveness. And what I'm going to do is I'm going to tilt my computer screen down a little bit just so you can see it. But you always want to check for responsiveness. Can you see that okay?
Yes. Yep.
Okay. So always, hey, are you okay? That's important because, quite honestly, if they're just sleeping on a park bench, you're going to make a real good friend and real bad enemy real quick. So always make sure they're truly unresponsive. After that, you're always going to point to someone to tell them to call 911. Now, that's really important because in an emergency, if there's 5 or 6 people standing around, one person may think the next called 911, no one's called, or 911 gets inundated with the same phone call. So if you point to someone specifically and say, you call 911, everyone knows that's that person's job and they're calling 911. After that, you can also say, go get an AED if there's one available. So after you check for response, and if you have 911 called, now what you're going to do is you're just going to look for breathing. We used to teach a pulse check for lay rescuer, and that's no longer taught. And one of the reasons why is 35% of the rescuers out there thought there was a pulse and there wasn't one. So 35% of the victims never got a resuscitation measures implemented because there was no pulse. So now we just look for breathing and signs of life. If there's no breathing signs and no signs of life, we're going to go ahead and go straight into CPR. And on CPR for the child, basically your landmarks, you can find them one of three ways, is you can locate the nipple line, go in between it, or you can locate the sternum, go to the lower half of the sternum, but stay off the bottom. Or the third way is you can come up with the xiphoid process to where this notch is and go a couple fingers above it. All three ways basically get you in the same location. After that, you're going to get above the person and do 30 compressions. You're doing these compressions hard and fast, and you're doing them 1/3 the depth of the chest for child and infant. For children, that comes out to about 2 inches. For infants, that comes out to about 1.5 inches. And you're doing these at a rate of 100 to 120 compressions a minute. If you think about that song, Staying Alive, that keeps you on that beat. Like dun, 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 staying alive, that keeps you on that beat. Or you can just count it loud, 2 and 3 and 4. Anyway, you get to 30, 25, 26, 27, 28, 29, 30. You have to do a head tilt chin lift. You're going to pinch the nose. If you watch, you'll see the chest. Give 2 breaths of air, and you'll see the chest rise. And what's good about this standard is you just keep doing this 30 and 2, 30 and 2, 30 and 2 until someone takes over, or you get too tired, or the scene becomes unsafe, or there's an improvement in the patient's condition. But if none of those result, you just keep going as long as you can. Most of the time, either someone will take over or you will get too tired. But if the scene does become unsafe or there is an improvement in the patient's condition, you can stop then. Now, as far as choking, and that's very common in children and infants, the thing you do there for children is you do something called the Heimlich maneuver, or it's called abdominal thrust. And what you do is you get behind the child, you locate their belly button, you go above it, and you stay off this notch. I mentioned it as a xiphoid process earlier, but basically you're just anywhere in between here. You're going to make a fist, grab your fist, and give upward inward thrust, upward inward thrust, upward inward thrust, until they go unconscious or the object comes out. Now, if the object comes out, it's not a bad idea to call 911 anyway, because that may have made their epiglottis swollen. And it's good to go ahead and get them checked out. If they do pass out, what you're going to do, and they've made this real streamlined too, is you're just going to go straight back into 30 compressions and 2 breaths of air. But before you give the 2 breaths of air, you're going to look before you ventilate. So it's identical to CPR. So in CPR, you do 30 compressions, 2 breaths of air, 32, 32, 32. Unconscious choking, you do 30 compressions, look in the mouth, 2 breaths of air. 30, look into, 30, look into, 30, look into. So regardless if they're not breathing and they're unconscious, you're doing 30 compressions and 2 breaths of air. However, if you think they're choking, you're doing 30 compressions, look in the mouth, and 2 breaths of air. That's the only difference. So they really streamlined it. And that's basically it for child. And I'll show you infant here in a second, but if anybody has questions, I'll take those before I go on to infant. And by the way, medicine is really, this is more really weight-based instead of age-based. But we teach an age because, quite honestly, if you ask most dads how old their kids are, they're going to be able to tell you. If you ask them their weights, you got to look at their mother and say how much does your kid weigh. So the point being is, if you have a 11-month-old that looks like a linebacker, you can probably treat them like a child. And if you have a child that's very petite, say 13 months old, you can probably treat them like an infant. But those are kind of broad categories that we put them in.
What part of the hand are you contacting on the?
Okay. Yep, I'm using the heel of my hand. Okay. And a couple tricks of that is if you can get your elbows and shoulders directly over their sternum and keep yourself locked in. Some people want to bounce like this, you know what I mean? But if you can keep locked in and do that, that's a better way to do it. And some people also want to rock like this as they're doing it.
Yeah.
Try to do that. Try to just come straight over. But I can tell you this too, is in CPR classes back 20 years ago, there used to be all these little things that were, you're doing this wrong, you're doing that wrong. And what we found out is people would be like, if I can't get it right in CPR class, how can I get it right when I'm stressed out on the real thing? So what we do now is, hey, do something. If you forget everything I'm telling you today, it's okay. Do compression only CPR. But if you can remember to throw a couple of breaths in there, perfect. If you give 33 compressions on one breath or 26 compressions and 3 breaths, you know what? That's better than nothing. I'm going to give you a high five when I see you. So
right. And then now you're going to show us the infant one?
Yes.
Okay.
So infants, a little bit different. When you breathe into an infant, you know, in child, I told you breathe into you pinch their nose. On an infant, you breathe in their mouth and their nose because they're so small. Okay. The second thing is when you compress on an infant's chest, instead of using the heel of your hand, you use 2 fingers. Your 2 fingers are in the center of their chest, just below their nipple line. Now, there's 2 ways to do this. One, you can use your fingers like this, okay? But then there's also a 2-thumb encircling method where you can use your fingers sort of like this. Okay, that's a little bit easier if you got big fingernails, or if you're getting tired out, you can use this method. If you're doing CPR on an infant, you're still doing 30 compressions, 2 breaths of air. If they're unconscious, you're still doing 30 compressions, look in the mouth, 2 breaths of air. So I'll show that once. You always come up, check for responsiveness. Hey, are you okay? There's no response. You call 911, get the EAD. Now I'm going to look for breathing. There's no breathing. And I'm going to start CPR with the 2 fingers. And I'm going to do these, like I said, at a rate of 100 to 120 compressions a minute, 25, 26, 27, 28, 29, 30. I'm going to do a head tilt, chin lift, 2 breaths of air. I'm going to give 2 breaths of air. The chest will rise, and then back to 30 compressions, 2 breaths of air. You keep doing this, again, those 4 situations till you get too tired, someone takes over, the scene becomes unsafe, or there's an improvement in the patient's condition. If they're choking, you still do the 30 compressions and 2 breaths of air, but remember, you look in the mouth before you ventilate. So that's, you know, real easy on infant CPR. It's so similar to child. They've made them similar. And by the way, on all 3, I said 100 to 120 compressions a minute. A lot of people say, am I going to get 100 to 120 compressions a minute? Well, maybe, maybe not. What you're doing is that's your rate of speed. It's like driving down the road at 100 miles per hour, but stopping every 30th mile to rest. Are you going to get 100 miles in 1 hour? Probably not, because you're stopping every 30th mile to rest. You're trying to get in 100 to 120 compressions a minute, but you're stopping every 30th compression to give 2 breaths of air. But that's a rate of 100 to 120 compressions a minute. Like I said, you can go by that BF Staying Alive, or you can count out loud 1 and 2 and 3 and 4. Or you can remember, okay, that's about 30 compressions in 17 seconds. And something we like to tell people is if they can count out loud, that's really good. And some people ask, well, why is that important? Well, think about this. If you're in your place of business, you call 911 and you're in a back room, for example, and the fire truck gets there, the ambulance gets there, and they're looking for you. Well, if I arrive on the scene and I hear 26, 27, 28, 29, 30, I know 2 things going on. I know A, where you are, and B, I know probably what you're doing. You're doing CPR. So if you count out loud, that kind of keeps you focused. That keeps your mind, you know, on task. Now, as far as choking on infant, you don't do, am I talking too quick?
Not at all. Okay. You're doing great.
Okay. On choking on infant, instead of doing the Heimlich maneuver, you do a series of back blows followed by chest thrusts. And I'm going to, like I said, I'm going to try to keep this in frame. But the back blows, what we do is they're between the shoulder blades. You're going to use the heel of your hand, and you're going to give 5 of them. 1, 2, 3, 4, 5. You're going to sandwich them, turn them over. 5 chest thrusts with 2 fingers. Your fingers stay on the chest. 1, 2, 3, 4, 5. Sandwich them, back blows. 1, 2, 3, 4, 5. Chest thrust. 1, 2, 3, 4, 5. And you just keep doing this until they go unconscious or the object comes out. Now, a couple questions usually come up about this. What about shaking baby? Well, as I'm giving back blows, their head is in my hand, right? Their body's on my arm. As I'm giving chest thrust, their head is in my hand, their body is on my arm. A lot of people say, hey, is this right? No, that's not right. I see that at every family reunion. I'm like, bring them here. That's not right. But this is right, okay? Their head's in your hand, their body's on your arm. A lot of people ask, hey, are you covering up the airway? Well, if you look, I'm not covering up the airway, right? But if I do this, what am I doing? I'm covering up the airway. So hold their head like this. The other thing is, a lot of people say, you know, how are you actually holding them? Well, I'm holding them down a little bit. I'm having gravity help me get that object out when I do back blows and chest thrusts. And lastly, I'm not going to stand up like this when I'm doing them, because if you stand up, you're just going to be doing this, right? So you'd have your hand over your hand and your arm over your leg. You'd be, when you're doing this, you should be in a sitting position when you do the back blows and chest thrusts. And one thing I like to say on infants is, for CPR to be effective, they need to be on a hard, flat surface like a floor. So if you see a child on a couch or a bed, move them to the floor. On an infant, move them to the floor. On an infant, if you have a real sturdy table, you can move them to the table. Okay. So
yeah, we have. Oh, go ahead.
Oh, I was going to say. Okay, go ahead. Yep.
Yeah, she wants to know, when checking the mouth first for choking, is there a trick to checking the mouth, because you know how small their mouth is?
Yeah. So what I like to do on adult or child is I like to take my thumb and my index finger and kind of make it like that, and then I just pull up, and I kind of pull up on their jaw, and then I check the mouth that way. That's one thing I like to do. Another common question some people might be wondering is, when you're doing unconscious choking, say for a child, for example, you do 30 compressions, you look in the mouth, and you give 2 breaths of air. Basically, you're doing CPR, but you look before you ventilate. And some people say, hey, wait a minute, what if I don't see that object? What's that mean? Well, there's 3 thought processes on this. Is number one, you know, they ask, could I blow that object further down? And actually, yeah. And but there's a couple thoughts on that. Number one is, you have 2 lungs, and when your trachea splits into 2, it's called bifurcation, and it goes to your right bronchial and your left bronchial. Your right bronchial is a little bit more straight than your left one. And the reason why is, as most people can probably guess right now, is where's your heart sit, like right over here. Well, what you could do is inadvertently blow that object further down, and what's called a right main stem blockage. Well, now you get the use of your left lung. You didn't have use of any lung before. The second thought process is as these airways get, you know, go further down, they get smaller, smaller, smaller. Well, if you have an object that's stuck at the top of your trachea, when you compress on the chest, what you're doing is you're increasing what's called interthoracic pressure. And some of that air may be hitting that object, some of the air may be going around that object. But if, again, you inadvertently blow that object into a smaller air passage, now 100% of that interthoracic pressure is hopefully hitting that object to push it out. And the third thought process is, you're really not going to know unless you ventilate, because maybe they weren't truly choking. Maybe the object wasn't in their trachea, and maybe it was in their esophagus, which is common for kids as well. They may get like a marble stuck in their esophagus. They just can't get it down. You think they're choking, and then it solves itself. So,
right.
Yeah. So those are all good question, and very common questions.
Good. Well, before we sign off, is there anything that we didn't cover, or I didn't ask you, that you want the parents to know?
I would say the biggest thing is always do something and be as calm as you can during an emergency. I'd rather have someone that's around that's very calm and composed and trying to do something, that maybe someone's had all the training in the world, but they're panicked. I mean, think about, if you, hopefully none of the viewers have ever had to call paramedics, but if you get a paramedic there and they're panicked, think about that. How would you feel? And it's not like getting a pizza. You can't order a different paramedic. You get what you get, right? So one thing we always say is be sure to be calm, comforting, and reassuring, you know, and that's something that it's hard to teach, and it's something that comes with time, and some people are better at it than others. But I would say that's the biggest thing, is be as calm as you can. And, you know, if you think about a kid that's ever been hurt on the playground, like my kids when they were little, I remember one of them got hurt at the baseball field. And most coaches and most people, or at least me, I'll say, hey, kid, rub it off. You're okay. Throw some dirt on it. But then there's other parents that will go out there and run to their kid, and the kid looks like they're getting ready to cry, but they're not quite there yet. Now, if the coach says, walk it off, what's the kid do? He walks it off, goes back to the dugout. But for the parent out there that's screaming and this and that, what's the kid do? They start freaking out. And adults are really no different. So the best thing you can do is calm down the situation, be sure to activate EMS or call 911, and do something. Remember, if people walk away, I think statistics show that even though certifications are generally good for 2 years, after about 3 months, people start to forget some of the stuff. And that's the reason we've tried nationally and internationally to make these standards a little bit easier, that, hey, if you forget everything else, do compressions only, wait for EMS to arrive, get an AED, and then follow those. AEDs, by the way, stand for automated external defibrillators. Follow those prompts, because they did a study with 6th grade students. They found out 90% of the 6th grade students could use the AED with little or no training. And I can tell you, if 6th graders can do it, then we should be all right, right? So they've really made them simple. CPR has been made much simpler than it used to be, and do something. No one's ever going to fault anybody for doing something, and you are protected by the Good Samaritan law. Indiana has a Good Samaritan law, and you are protected by it.
Good. One last question before we go. They're asking about doing the Heimlich maneuver on pregnant women. Can you do that?
Yes. Great question. On pregnant women, let me get the other mannequin out. Instead of doing them on the abdominal area, you're going to go straight to the chest. Okay. And it's a straight back chest rest. And by the way, this is any time that you think they're pregnant. You may not know they're pregnant, but if you even think they're pregnant, you want to go straight to the chest. You're doing straight back chest rest. And then one more thing is to know that if you're choking and you're by yourself, you should do the self-Heimlich maneuver, or you should lean over a table or chair and do the Heimlich maneuver that way. Now I always joke with my wife. I'm like, hey, if you ever walk in the room, there's 4 chairs broke, I'm unconscious, and there's Reese cups next to me, it's not because I didn't try. So be sure to find a sturdy chair or a sturdy table, but try not to panic and do the self-Heimlich maneuver. But great question on pregnancy. Definitely do the Heimlich maneuver. And it's just actually chest rest. Do that around the chest and straight in. Yeah.
Wonderful. Well, Bob, thank you so much for all the information you gave us.
You're welcome.
I'm sure it's hopefully no one will ever have to use something you're teaching, but it's nice to have that in our back pocket should we ever need it. So
sure.
Thank you again for coming, and we really appreciate you sharing your knowledge with us today.
Okay, thank you for having me. And if anybody ever needs a class, they have our website. So
great. Thank you again. And to everybody watching, have a happy Valentine's Day.